Hey everyone, Lindsay here from Total Knee Prep. I'm a physiotherapist and an expert in all things related to knee replacement. Today I've got a little workshop for you called 3 Keys to a Successful Knee Replacement. Let's get started. So you're in the right place today if your knee pain is affecting your life and limiting the things that you love to do. Number 2, if you have no idea where to get started to prepare for your knee replacement, or if you want to learn a few simple things you can start doing today to get prepared for your knee replacement. So, I'm going to give you a few simple things you can do starting today from the comfort of your own home to help you start preparing and stop stressing about your upcoming knee replacement. So, take a moment and think about how you feel day to day about preparing for a knee replacement. Are you somebody who starts to think about it and starts to get a bit panicked or anxious? You may have tried several things to get ready, suggested by your doctor, or be given a sheet or booklet of things that you should do ahead of time. Sometimes you get started on something and then you discover that it's actually making your knee pain worse, so you have to stop. Or you're tired of living with chronic knee pain and you really want to make a change. So, the goal would be to feel like you have a simple plan to get prepared for surgery and you know where to get started. You want to be active while you wait without paying for it afterwards, for hours or even days. You want to feel confident about the road ahead when you think about your knee replacement. And you want to learn a few simple things to help manage your knee pain now and after surgery. So let me introduce myself. My name is Lindsay and I am a physiotherapist. I work at a hospital in Canada that specializes in joint replacements. I've helped hundreds of people get out of bed for the first time after their knee replacements, and my goal is to change the way people get prepared for their surgery. I've seen how preparing in advance and knowing a few key things can lead to great success and less pain after surgery. So let's dive into this workshop. The first thing that you should focus on when getting ready for your knee replacement is to focus on strengthening the quads muscle. The quadriceps is this large muscle that runs from your hip across the knee, and it provides much of the balance and stability at the knee. If you only had time to focus on one muscle before surgery, this would be the one to focus on. So you may be wondering, why is this muscle so important? Well, first of all, it's because of the location. It crosses the knee joint and attaches to your kneecap or your patella. The function of it is to help bend and to straighten when you're in a standing position. Weakness in this muscle puts more strain on your knee joint and can lead to more pain. And tightness in this muscle can actually lead to stiffness and loss of flexibility, which after your knee replacement is so important to regain full flexibility to improve your function day to day. The second thing to a successful knee replacement is to know how to lower your stress and anxiety before and after surgery. Learning a few simple breathing or relaxation techniques is a great way to reduce your stress. Having a calm and balanced approach to your pain management can really help in the recovery phase. So you might be wondering, well, how is my pain linked to my stress? Well, based on research over the last 20 years, they've discovered that there's many factors that can contribute to chronic pain. And when you have arthritis, most definitely you're often suffering with chronic pain. Look at some of the components included in this pain cycle from the Arthritis Society: fatigue, depression, fear, anger, frustration, stress, tense muscles, and the actual disease pain from the arthritis are all things that contribute to the pain. So if you can tackle one or few of those components, you can manage your pain better before surgery. So let's give this a quick little try. We're going to spend about 30 seconds just focusing on some breathing and see if we can't take some tension and stress and remove it. So find yourself a comfortable sitting or laying down position, close your eyes, and allow your body to relax and just listen to my instructions. I want you to take a deep breath in through your nose, filling up your belly for a count of 4. 1, 2, 3, 4. Hold that breath for a count of 4. 1, 2, 3, 4. And now breathe out for a count of 4. 1, 2, 3, 4. Pause and repeat. In, hold, and out. This time, as you do that breath, 4 in, 4 hold, and 4 out, imagine your muscles around your knee turning into puddles and melting away. The muscle at the front of your thigh, the muscle at the back of your thigh, your calf muscle, and all the way down to your toes. Take 2 more deep breaths, allowing your body to become heavy and relaxed. All right, gently open your eyes and come back to the present moment. Hopefully that was helpful in just showing you how in a few minutes you can actually change your pain. So think to yourself, how are you feeling now? Did that have any effect on you? Knowing a few simple strategies that don't involve medicine to manage your pain can be really useful after a knee replacement because pain is one of the biggest problems that people struggle with after their knee replacement. All right, let's move on to the final key to a successful knee replacement. Now, do you have any guesses on what the most essential piece of equipment is for after surgery? Here's the answer: a two-wheeled walker. Now, most people think, I don't need a walker. I don't want to look like an old lady or an old man wandering down the street. But I'm here to tell you that a two-wheeled walker is your best way to get walking well straight after surgery and to get you back to your normal walking pattern as quick as possible. The reason a two-wheeled walker is so helpful is that your new knee needs a lot of support initially. The muscles around the knee are switched off because of the pain and the trauma to them after surgery, and they can take a couple weeks to get strong enough to be able to support your body weight again. So, while these muscles are weak, you don't want to develop a limp. If you start limping after surgery, it's really hard to break that bad habit after a few weeks when the muscles become stronger. So if you use the walker when you first get started, you can prevent yourself from developing that limp. And the third reason is that you want to stay as balanced as possible. Crutches are an option for people, but because there's only 2 points of contact, they can be a little bit less steady, and you could potentially have a stumble or a fall. And you definitely don't want to land on the floor in the first days and weeks after surgery. It's awfully hard to get back up again. So, just a quick thing that you might not have considered before this little workshop is that you might actually need a walking aid now. Now, a walking aid could be a cane, a crutch, a walker, or even a wheelchair. But for most people, it's maybe walking poles, hiking poles, or a single point cane that might do the trick. You know you need a walking aid if you currently walk with a limp, you limit how far you walk because of your knee pain, or you're starting to get pain or weakness in other joints because of the pain at the knees. So here's a quick recap of the 3 keys for a successful knee replacement. The best place to get started is to start strengthening your quads muscles around the knee. Pain control is more than just using medication. Stress can have a major role in your pain, and controlling that with breathing exercises or relaxation techniques can be a great way to reduce your stress and your pain. And last but not least, using a two-wheeled walker after your knee surgery will allow you to get moving quickly and safely. So I have a quick question for you. Where could you be in 30 days if you got started with just these 3 things? And you might be wondering, well, how am I going to get started? Well, you're in luck. I've got a solution for you. Let me introduce you to the Total Knee Prep course. This course is designed to increase your strength, decrease your pain, and rid yourself of any fear around having a knee replacement. I've seen it time and time again where people show up for their knee replacement full of fear and not knowing where to get started in their recovery. This course is going to help you transform that fear into confidence and allow you to be in control of your recovery. It's divided into 6 weekly modules, including video tutorials, exercises, and a workbook that includes journaling exercises and other course information to supplement the videos. Some of the highlights include the fact that it's completely online, and so all you need is an internet connection to complete the course. So if you travel or enjoy completing things at any time of the day or night, this allows you the flexibility to complete it at your own timeline. It combines exercises for your mind and your body, which is something unique compared to most people's approach to preparing for surgery. You'll have lifetime access to the course, so even if you purchase the course today and you don't have surgery booked for a year from now, you'll have that access right up until your surgery. There's also a private Facebook group just for people in this course, so you can meet other people preparing for surgery and help support each other along the way. So take a moment and think about where you are today and where you could be in just a few short weeks. Wouldn't it be nice to get back to the things you love doing without worrying about your knees and enjoy waiting for your knee replacement as opposed to suffering? The Total Knee Prep course is unlike any other because it combines physical preparation, which includes exercises and activity practice, such as getting in and out of bed, practicing stairs, and getting up and out off the toilet and out of chairs. It also includes the mental preparation, some journaling things to work on, relaxation and pain control strategies, and education so you can feel like you have all the tools you need to ensure that you have a successful knee replacement. Now, because I know that this course is so valuable and that you'll get such a benefit from it, I have a wonderful opportunity for you to join me risk-free. I have a 14-day refund policy, so that gives you access to the first 2 modules risk-free to check everything out, see if the course is for you or not, and if you're not completely satisfied, request a refund and it will be returned to you within several business days. The worst case scenario would be not joining and risking losing 6 weeks more pain. The best case scenario is you buy the course, follow the step-by-step program, slowly build your strength and your confidence, and by the end of the course, you feel completely prepared for your knee replacement. So take a moment and think about your life a year from now. What are some things you've been putting off because of your knee pain? What are the activities you want to get back to? Or is there something new you've been wanting to try, but you knew your knees couldn't manage it? Just because you're waiting for a knee replacement doesn't mean you need to suffer. My new approach is a slogan that I've heard an orthopedic surgeon say about 5 years ago at a course. He said, "Don't waste the wait. While you're waiting for surgery, there's so many things you can do to make your life more manageable." So here's a brief rundown of the things that are included in the Total Knee Prep course. I'm so happy to offer you this course for a one-time payment of $447. And if you join between now and September 25th, 2023, you'll have a bonus of 6 weekly Zoom calls where you'll get support live online with me as your coach. And I'm also going to throw in 2 mini courses that I've created for after surgery. The first is called Rest and Recover, and it's designed to help you get the best night's sleep possible after surgery. The second course is called 5 Easy Ways to Get Your Knee to Bend. It's got videos and instructions of how to maximize your bend after surgery, which is actually a $244 value. So don't delay and join the new 6-week Zoom call coaching of Total Knee Prep starting September 25th. For all the details, follow the link in the comments below, and I look forward to seeing you in the course. Have a wonderful day.